Good morning, doctors. Welcome again. Today we are going to discuss about primary sclerosing cholangitis. Is a long-term progressive disease of the liver and the gallbladder characterized by the inflammation and scarring of bile ducts, which normally allow bile to drain from the gallbladder. So, hope it's clear for you. See, the normal gallbladder, cystic duct, hepatic duct, and common bile duct. But in this side with red arrows, they show there is primary sclerosing cholangitis. See, it's visible. Now, what are the symptoms of primary sclerosing cholangitis? That is abdominal pain, itching, weight loss, dark urine, and enlarged liver. Okay. Now, PSC occurs most often in a man between 20s to 30s. Up to 80% also have an IBD, irritable bowel syndrome, inflammatory bowel disease. The most common symptoms are pruritus, jaundice, abdominal pain, and fatigue. The diagnosis is confirmed by imaging studies showing a string of beads patterns of the intra and extrahepatic bile ducts. Patients are at increased risk for developing cholangiocarcinoma, SCC, hepatocellular carcinoma, CRC, with IBD. Liver transplantation is associated with improved quality of life and survival. Now, it is made in a patient with diagnosis cholestatic biochemical profile when cholangiography, example MRC, ERC, percutaneous transhepatic cholangiography, shows characteristic bile duct changes with multifocal strictures and segmental dilatations, and secondary causes of sclerosing cholangitis have been excluded. Patients who present with clinical, biochemical, and histological features compatible with PSC but have a normal cholangiogram are classified as a small duct PSC. Okay. In labs, sometimes we find normal SGOT-PT but increased alkaline phosphate and increased ZZTP. Here is the AMA titer is negative, ERCP and transhepatic cholangiogram will be the definitive. ERCP is endoscopic retrograde cholangiopancreatography and MRCP is magnetic retrograde cholangiopancreatography, magnetic resonance, MRCP. And treatment is by the bile acid binding resin, that is cholestyramine, or liver transplant we can do. Cholestyramine for oral suspension, each 9-gram pouch contain a 4-gram cholestyramine resin, and the product contain the sucrose, and the doses is 4 gram per dose. And hyperlipidemia 4 gram, increase gradually over more than 1 month interval. Maintenance dose is 8 to 16 gram per day per oral, not exceed than 24 gram per day. Okay. In pregnancy or lactation, this cholestyramine drug not enter in a breast milk use in lactation causes, and because of potential vitamin loss in mother, it's caution. But in pregnancy category, generally acceptable. Control studies in pregnant women show no evidence of fetal risk, may be acceptable. Either animal study shows no risk, but human study is not available, or animal study shows minor risk and human studies does not show no risk. So guys, hope till here it's clear for you. If you have any query, any question regarding this primary sclerosing cholangitis, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you, good day and goodbye. That's all for today.